Nicole here, and I just want to start this video by saying I'm really sorry if you've suffered recurrent pregnancy losses. A pregnancy loss where that pregnancy was wanted is often so deeply painful, and our culture isn't great at supporting grief in general, and especially this kind of unseen grief. If you're feeling alone, unseen, or like you're supposed to just be moving on, please know that I see you. Your grief matters, it is appropriate, and you deserve lots of support. I'm really glad you're here. Today, we're going to cover these really important recurrent loss topics. How common is recurrent pregnancy loss, or RPL? Why does it happen, both from a Western medical and a holistic Chinese medicine perspective? What you can do, both practically, emotionally, and also holistically. And most importantly, is there hope and what should be next for you? You're going to find different numbers depending on where you look, but RPL happens in about 0.5 to 5% of people, with most sources stating that it happens around 1 to 2% of the time. Now, the definition varies because some say 2 consecutive losses are recurring, others say 3, depends on the country and the clinic. But statistically, after 2 losses, the risk of a third is about 30%. And after 3, the risk of a fourth is 33%. It's pretty close. But here's something kind of hopeful. Even with 4 losses in a row and no living children, the chance of a successful pregnancy in the next attempt are still 55%, which is technically pretty hopeful, but also, let's be real, a 45% chance of a loss is still really hard to sit with. And this isn't just about the statistics. It's about what those numbers mean for you and your body and your heart and your emotions. A 55% chance of a baby and a 45% chance of another broken heart is really hard. I want you to think about when was the last time somebody asked you how you were really doing in all of this, not just how your hormones are or what you're doing next. It matters. So why does RPL happen? When it comes to one-time random miscarriages that people have, the most common cause is chromosomal issues, essentially just some random genetic errors that can happen sometimes. But with recurrent loss, that explanation becomes less likely, which means that in most cases, there is something else going on. Think about your body like an orchestra. Sometimes just one instrument is a little bit off key, so if we can, we want to find which one and help tune it up. So here's a breakdown of the known medical causes from a Western medical perspective. Immune system factors like antiphospholipid antibody syndrome, which is APA or APS, or systemic lupus syndrome, SLE, is about 20 to 30%. Anatomical issues like fibroids or uterine abnormalities, 10 to 15%. Hormonal issues like thyroid disease, progesterone deficiency, or diabetes, 15 to 20%. Infections like bacterial vaginosis and ureaplasma, 1 to 5%. And genetic factors, including controversial variations like MTHFR, 2 to 5%. And depending on the study, recurrent loss is due to unknown causes as much as 30 to 50% of the time. Now, I know that last statistic in category is especially frustrating, but just because we don't have a clear medical answer doesn't mean there isn't a cause. It just means that the current science hasn't caught up to it yet. And this is where holistic medicine really shines. Because instead of waiting for a perfect reductionistic diagnosis, we can start working on balancing the body and big picture in ways that support fertility. And often that's enough to make a difference. Did you know that traditional Chinese medicine's oldest specialty textbooks and writings are on obstetrics, pregnancy, including recurring pregnancy loss, threatened miscarriage, bleeding during pregnancy, cramping during pregnancy, things like that? This is because if you could afford medicine that long ago, you likely had a fair amount of money and resources, and you cared a lot about your lineage. So again, the most specific textbooks early on in Chinese medicine were for supporting pregnancy and fertility. Now, to make Chinese medicine a little more accessible, in my 90-day fertility program and practice, often I compare getting pregnant to going on vacation. Most of the time, when a person goes on a vacation, they're going to stay on vacation. But in a minority of cases, the body needs to leave that vacation early. And the holistic reasons for this can vary and can sync up with those Western causes. An autoimmune issue, it's like your resort got attacked. You gotta leave. It makes sense. A clotting disorder, it's like the resort ran out of supplies. Again, you'd leave. A bacterial infection, that's like an outbreak on the cruise ship. And hormonal imbalances are like the resort hasn't been staffed appropriately and it's just not able to function. Anatomical issues, those are like your resort developed a sinkhole or had an earthquake. And even when there's no clear mainstream medical cause that's found, there's always a holistic whole person pattern that a Chinese medicine person can find and work on. In Chinese medicine, this is called the differential pattern diagnosis. I've got a whole video about it, but let me give you a brief example here. If I work with someone who has totally unexplained recurrent pregnancy losses, I'll look at her history and I'll see lots and lots of little bits of information. For example, maybe her parents had a hard time and it took a little while for them to get pregnant too. Maybe she was born a few weeks early. She got her period a little bit later than her peers. And when her period began, it was pretty irregular. Now she's got a regular cycle, but she tends to feel pretty fatigued, especially certain times of her cycle. She tends to be anxious. She also gets night sweats around her period and wakes up at night to urinate. Now, even though her Western doctor doesn't have anything specific to work on, I can easily give her a Chinese medical diagnosis of kidney gene deficiency. And there are acupuncture points and fabulous classic herbal formulas and some really intuitive and very doable big picture lifestyle supports and tweaks that would help her feel better right here and now. Less fatigue, better sleep, less anxiety, fewer night sweats, and help her get pregnant and stay pregnant and avoid another loss. I see it all the time. It can make a huge difference. It really works. So, what should you do next? There are some practical steps that you might want to take. It might make a ton of sense to investigate some of those known Western causes if there's a reason to suspect them. For example, if you've had symptoms of a yeast infection that never really fully goes away, maybe look at other types of infections. If you're fatigued all the time and feel cold, maybe look at your thyroid levels. If you've had a history of STIs or pelvic inflammatory disease, make sure there's no scar tissue inside your uterus. But mostly try to combine that with staying big picture. And that might seem woo-woo, but again, it's not. I want to share a really big deal study. A study published in the Journal of Obstetrics and Gynecology in 2019 reviewed outcomes for women who had had 2 consecutive miscarriages and no living children. And here's what they found. A cause was identified in only 29.3% of cases, but in 82.3% of cases, they conceived again, and in 72.7%, they had a live birth. And the biggest takeaway, the study specifically said, and I quote, over-investigation and treatment should be avoided with a greater emphasis placed on psychological support and risk factor modification. Investigation protocols must be refined to only search for causes of recurrent miscarriage with evidence-based treatment. That's right. It said investigate where there's evidence-based treatments for the things, not randomly, not throwing kitchen sink and things that haven't been proven at it. And most importantly, stay focused on the psychological support and risk factor modifications, big picture stuff. Let me say it again because it's so huge. Over-investigating and over-treating aren't the answer. Emotional support, lifestyle shifts, addressing risk factors, those are the things that are scientifically proven to help the most here. You know what helps blood flow, immune balance and function, and overall reproductive health in all sorts of scientifically proven ways? Big picture balance. And that doesn't mean expensive treatments. It means prioritizing your nervous system, reducing and interrupting stress cycles, sleeping better, grieving appropriately, processing PTSD from losses, and reconnecting and trusting your body. all the big picture things that I'm really passionate about cultivating and teaching. Healing from pregnancy loss isn't a linear thing, and it doesn't need to be. It's going to be more like waves in the ocean. Sometimes it's gentle and pretty peaceful, and sometimes it's crashing down on you. It's okay to feel all of it. Don't listen to people who say just relax or move on and it's going to happen. So let's just take a pause right here. Place a hand on your heart if you can, and take a deep breath. I want you to acknowledge how hard this journey has been, and I want you to know that you're doing your best with what you have, and hopefully this video only adds more to that. For those of you who are partnered, remember that partners often experience loss really differently. You're going through something physical and logistical and emotional. They might be processing primarily through an emotional and logistical lens with a really different set of thoughts and conditions than yours. It's important to still try to create a space to grieve together, even if it's a very different type of grieving. Perhaps a simple ritual like lighting a candle or planting plants, or even going on date nights regularly. Help bridge those differences and stay connected. Couples therapy can also be great, especially with a person who's skillful with grief. Now, I want to end this video by sharing a story of amazing outcomes and hope. I worked with a woman named Ryan, and she'd had at least 8 documented losses fairly far into her first trimesters, and she had never given birth. Ryan and I spent months working on her anxiety, PTSD from all these losses, and balancing her overall health. Along the way, she also pursued testing based on when she kept having her losses, around 8 or 9 weeks, and she did find out she had APS. She pushed her doctor to add blood thinners, and her doctor agreed, and then she got pregnant with twins, as luck would have it. Now, it would be easy to say that blood thinners were the magic bullet for her to successfully carry her twins, but here's the twist. A little over a year after her twins were born, Ryan showed up in my waiting room, pregnant again, without even trying. She had actually only ovulated once since their birth and got pregnant on that cycle. But because she never got her period, she assumed she still wasn't even cycling. By the time she realized she was pregnant again, she was already in her second trimester. And guess what? No blood thinners. So, was it the blood thinners? Did something change? Was it a combination of big picture care and emotional healing and believing that a pregnancy was possible? It's impossible to really know. But this altogether is why I believe so strongly in a holistic approach. We don't need to reject the medical interventions. We need to use them in a way that fits the holistic big picture and integrate them into a framework that supports you as a whole person. So if you're going through recurrent loss, I want you to know that you don't have to do this alone. Connect with others who understand. I want you to look up local or online recurrent miscarriage support groups. Check out the hashtag RPL community hashtag on Instagram and other social media platforms. Consider listening to books written by people who've had recurrent loss. I've got a Facebook page for loss, and my Extra Awful Fertility freebie is a wonderful resource for those with recurrent loss. However you do it, I want you to do what advice columnist Dear Sugar said, and I'm going to wildly paraphrase her here. Find others who have walked on the same planet as you. There's lots of people that are going to try to support you the best they can, but if they've never stepped foot on planet repeat miscarriages, it's not the same as talking to someone who has. Is there hope here? Yes, absolutely. Even after multiple losses, most people go on to have a baby. Research shows about 65 to 70% of women with RPL eventually have successful pregnancies, even without specific Western treatments. And those odds only improve with appropriate big picture care. But more than that, remember, you deserve to feel whole in this process. You deserve care and safety and support and a plan that doesn't only focus on statistics and bits and pieces, but sees you as a person. So let's keep working to change how we support pregnancy loss, because you absolutely deserve so much more and better, and you certainly are not alone. I'm really honored that you pressed play and watched this video. Please count me as one of your community. I'm sending you some love. If you're up for it, please show some love back. Leave me a comment and like and subscribe. I really appreciate your support, and I'm glad you're here.